Living Clean, Living Well is a presentation of the Canadian Centre for Abuse Awareness and is brought to you by Renaissance. The road to recovery starts here.
Hello everyone. Tonight on Living Clean, Living Well, dealing with the dual demons of depression and addiction, understanding them, how they work together, and also how you treat them. We're also going to be talking about the DSM-5 that is about to come out. What is it that you ask? Yes, we are going to be talking about it, how it could affect you, and also the medical treatment that you may be receiving. So anyway, we've got a big show ahead of us. We welcome tonight Dr. Vera Tarman, who is the medical director of Renaissance. Welcome to the show.
Well, thank you. I'm very happy to be back.
We have a big announcement tonight for you. Going forward in the weeks and months to come, Dr. Tarman is going to be joining us every other week. So you're going to be seeing an awful lot more of Dr. Tarman. We found that our viewers were really relating to you, Dr. Tarman, and so it's really great that we're going to be able to have a great collaboration and come together and to have a medical doctor on set as well. I think it's going to be great for our viewers. So thank you for doing this with us.
Well, thank you, Teresa. I'm really, really happy to have the opportunity to do this. I mean, I love working here at Living Clean or appearing at Living Clean because it's a call-in show. And I mean, I'm a real frontline type of person, and this is my way of being able to connect with people outside of the scope of my work. I'm really looking forward to working with you and answering all of your questions. I'm so grateful that Living Clean exists so that we have that opportunity.
Yeah, it's great to be able to talk about this subject. And I've always said a safe haven where you can come and talk.
Yeah, because, you know, addiction is something that generally has quite a stigma attached to it. But if you call, you must know that your question, there's 10 people who are either asking the same question or wanting to hear the answer.
Yeah, good point. So, over the last couple of months, we've been listening to you and what you've had to say. A lot of people in pain, continue to be so. We thought perhaps it was just getting over the holidays and everything. A lot of people with anxiety and depression. And so tonight we thought that we would bring in Dr. Tarman and talk about addiction and depression and how they all come together. Dr. Tarman, why don't you start us off with the different types of depression so that we can start to understand this?
Okay. Well, I mean, you mentioned a number of things. You mentioned depression, anxiety, and then of course there's bipolar disorder, and just mental illness in general, or the diagnoses. With addiction, it's much higher. It's like people who have an addiction are usually dual diagnosed at least by a third more than the regular population. And depression is certainly one of the most common ones. And so, you know, what are the different types of depression? Well, there's, you know, the standard one that we all know about, which is major depression. And that's where you have the full spectrum of all of the symptoms. But there are other ones as well. There's another diagnosis which is called dysthymia, which is, it's like depression, but you don't have to fulfill as many of the criteria. With major depression, you have to have 3 of a number of symptoms, which I can tell you what they are right now.
Yeah, sure.
Things like difficulty either sleeping too much or not sleeping well enough. Hallmark symptom is not being interested, having no joy in things. You know you should like to do something that you normally do, but you'd have no interest. Wanting to be alone all the time, not wanting to socialize, not wanting to eat or eating too much. Often another hallmark symptom is feeling hopeless, feeling really discouraged about yourself. That's another symptom. And then sometimes if it's bad enough, what we call suicidal ideality, or just thinking about suicide all the time. And that might just be thinking about it, like wanting to do it, or just, I don't care if a car runs me over. It's called passive thinking. Dysthymia is where you have a few of those over a longer period of time. And then there's other types of depression that are not, like major depression is a person might have that for anywhere from 3 to 6 months, and then eventually it'll relent, it'll pick up. And a person who has major depression might have it over the course of a lifetime, 3 or 4 or 5 or 6 episodes. But then there's other types of depression, like postpartum depression. Just happens during and after a pregnancy, which is probably hormonally related. There's the type of depression that can occur after a major event like grief. You know, what we would normally call grief can become, if it's beyond the time period that we think a person should have recovered, but it extends and goes beyond that, then we start to call that depression as well. We have seasonal affective disorder, which is another type of depression specific to the season. So you can see there's many different kinds.
Yeah, wow. How about some of the causes? Let's talk a little bit about those as well. I mean, everybody wants to know why does this happen?
Okay, well, it's multifactorial. There's so many different causes. I think that a lot of times people wonder if it's genetic or if there's some kind of biological predisposition, because I think there's so much stigma around depression that people feel like, you know, there's something wrong with me, I'm not doing something right, and therefore I'm depressed. And that's part of the whole stigma. There does appear to be a genetic component in that a person who has a family member, a parent, even a grandparent, has you know, 3 times more likely a chance to be depressed than somebody who doesn't. But there's lots of people who can be depressed not because of a specific family. There does appear to be a biological component to depression. There is a neurochemical change. We're not exactly clear on how it works, so we just say it's a neurochemical imbalance. But exactly how that works is still really not very clear. So genetics is one thing, but it can be childhood adverse conditions like abuse or trauma. It is a major cause of depression because, you know, the templates are laid down early that you feel bad about yourself, and then you carry that kind of thinking the rest of your life. And whenever you have a negative thought in your head, it's going to affect your mood.
And how about some treatment for depression?
Well, that's a pretty big question.
Yeah, there's lots of ways that you can treat, and a lot of things I imagine you've got in your toolkit, right?
I mean, the predominant 2 ways are, well, I'd like to say 3 ways. The predominant way from a medical perspective is medication, antidepressants. The other way is types of therapy to kind of find out what those thoughts are that you've probably laid down as a child and unintentionally are still carrying around. But I'd like to put a plug in for the lifestyle changes too. And these ones we tend to ignore, but they are actually more powerful than medication. Things like getting enough sleep, becoming social even if you don't want to be, changing your diet.
And I hear that, you know, going outside and getting a little bit of sunshine.
Exercise,
you know what I mean?
absolutely,
And exercise too.
Yeah, I mean, we can talk more about each one of those over the course of the hour, because all of them, I think, we tend to underestimate, but they are really important. Yeah.
So there you go. We have set the table. This is our topic tonight, depression and addiction, how they work together, how we treat them, how we understand them. I'd also like to put it out to you. Have you, folks that are watching our show tonight, have you dealt with depression, perhaps the dual demons, as I talked off the top of the show about depression and addiction as well? How did you work through it? And what worked for you? Because like you said, somebody could be out there asking that question in their mind. There could be 10 people that want to know. So maybe you could call in as well, because we like to bring in all of our callers and to make them so much a part of our show.
Teresa, can I just interrupt?
I
forgot one of the most important ones. Addiction can cause depression. I don't want to forget that one.
Yeah, it can, because I guess they're natural depressants, right?
That's right, absolutely. Just medications themselves, including drugs and alcohol. Yeah.
Yeah, so there you go. It's a big topic. Already our phone lines are starting to line up. So we are going to take our first break. But just before we go, we've been telling you about a new movie that is out in the theaters right now. It's called Home Run. It's about a Major League Baseball player that is dealing with addiction on his own. He has to go back to his small town. It's in theaters right now. We've been telling you about it. We gave away some tickets. We're all done now with the tickets, but we did want to tell you a little bit more about it and to promote it one more time. So as we go to break, we're going to be back to take more of your phone calls. But as we go to break, here is a look at Home Run that is in the theaters right now.
You've been suspended for 8 weeks.
What are you talking about, Blue?
The Grizzlies want proof that you're attending a 12-step program.
12-step?
They want you out of sight until you've completed 8 weeks.
Have you been suspended by the Grizzlies?
Mr. Brand has kindly offered to stay here in Okmulgee as head coach of the kid baseball team.
Emma Johnson.
I'm actually one of the Bulldogs' other coaches.
I think I landed in the wrong room over there.
Bring it in! Bring it in!
You're in the right room. Just takes a while to know it sometimes.
There's no freedom for the faithless here, who only see through hollow eyes of fear. Have you traveled well to what you want to be? Let me walk you to the water.
Welcome back, everybody. I'm Teresa Cruz, your host, along with Dr. Vera Tarman, who is the medical director of Renaissance. Tonight, we are talking about addiction and depression. We are here to take your phone calls as well. Our toll-free lines are now open. And as I mentioned just before we went to break, if you have any experience in the area of what you may have gone through with depression, addiction, what worked for you, maybe you're still working through it and you'd like to talk to Dr. Tarman, we would like to talk to you, so pick up the phone tonight and give us a call. Let's go to our phone lines right now. Line 1, and calling in from Hamilton is Celine. Hello there, Celine. How are you tonight?
Oh, well, I guess I'm doing fine. I'm kind of on the downside, I guess.
That's okay.
Discouraged incredibly, and I had a question to ask, is that, so I don't take up too much of people's time. I'm borderline illiterate and basically not very smart, and I had a terrible working condition and found out that my privacy was breached because a lot of institutions were able, because of how the program was written, were able to obtain my people's information without asking them and entering them into a working contract. And I took it to a department in the government to complain and gave them the proper evidence, and I was told that if the opposite side could not come with documents and I had them, that I had proven my case. Well, that wasn't the fact when they wrote out the document. And now, being a person that's borderline illiterate, I'm forced to take it to federal court. Just imagine if you're a blind person and somebody tells you to write, with a pen, and you can't see where the paper is, and the paper's on the other end of the table. Sure. Well, that's like me in court. And so I'm forced to do that because I can't find anybody to represent me. And every time I think of this, I get beyond imagination of I'm angry to I can't even describe. And I'm upset and I cry. I thought I wouldn't do it this time, and I had hoped. But anyway, what do I do? How do I know that Christ can give me encouragement, but I kind of have had enough 13 years trying to prove, different avenues of what hell I went through at the workplace.
Yeah. You know, Celine, what you described, the situation, unfortunately, our show is the type of show that we can't help you with any legal advice or anything like that. But it does sound like you're terribly low and dealing with a lot. Dr. Tarman, when we're presented with circumstances in our life and legal problems and you just get beaten down and beaten down, and if you have somebody sitting in your office, what would you say to Celine about dealing with problems in life that just really get to you?
Well, I mean, what I hear, Celine, is that you're feeling really overwhelmed by issues that are you know, life changing. I don't know what to suggest other than I hope you're not trying to deal with this alone, because that makes it so much harder. I don't know if you have a caseworker or if you have family, somebody who can help you with this, so that at least you're not doing this alone, because that will make it a little easier. Yeah, that's really all I have to suggest.
In the case of where somebody's really downtrodden and low with the events that are going on in their life, when you go in to visit your doctor, you know, I'll put my personal case on the line. Last year we went through a tremendous amount of deaths, and I was depressed as well and everything. And I remember going in for my medical and my doctor looking at me and she said, "Are you okay?" And I really felt the next question was going to be, "Do you need some medication?" How are doctors dealing with that? When is the right time to medicate and when isn't?
Well, that's a very difficult question. I would say that it sounds to me like Selena's got more going on than just what's happening right now, because there obviously something has happened previous to lead to this sort of breakdown of her situation. So it would be too complicated. My guess, Celine, is that you're probably on medication already.
No, I'm not talking about Celine.
No, but in your case, it would then depend on the philosophy of the doctor, because the doctor might just say, "What are your social supports? How can we strengthen them?" Another doctor might say, "Wow, would you be better to be on some medication to help you?" Because one of the things we know is if a person's depressed, they're the last person, because of their depression, to be able to pick themselves up and figure out what to do next.
Right.
Your ability to be clear thinking is, you know, shot.
Yeah.
And sometimes we think about medication as a bridge to get you over, so that you have then the clarity of mind to do what you have to do. So it's a kind of, it really depends on the perspective of the doctor.
Gotcha.
Yeah. When a person is at a point when they're just not functioning at all, that would be the time when you really have to suggest it. But prior to that, in your circumstance, I think it's up to the doctor, and also you.
Yeah, of course.
Because you might say, "Well, you know what, I'm not sleeping, and I really think I need something to get me over this."
Yeah. Yeah, well, I opted for without the medication, but I was just wondering how, but you're right, I think every doctor's different, isn't it, in how they deal with it.
Yeah.
So, Celine, you know, I really do wish that we could help you with your legal issue, but unfortunately with this type of show, we just can't. All the best to you, Celine, and thank you for reaching out tonight. Let's go down to line 4, and Anna Maria is calling in. Hi, Anna Maria, you're live on our show. Go ahead.
Hi, Dr. Tarman. Hi. I'm actually calling just to share first my experience with depression and addiction. I think the most important key is to be completely honest with your doctor about symptoms that you're experiencing, because being in recovery and being an addict, sometimes I like to you know, exaggerate on what's going on in my life. So having said that, being 100% honest with your doctor is really, really important to get a clear diagnosis. The second thing that I wanted to propose was a question to Dr. Tarman was around the ECT treatment that is offered at the Center for Addiction and Mental Health. I have a psychiatrist there, and I've actually been diagnosed with clinical depression and anxiety, and I went to a couple of ECT treatments and found that the treatment itself has actually caused me to have lots of memory loss. And I guess my question to Dr. Tarman is, if you know much about it, can you tell me, like, what are some of the effects, the positive effects of getting ECT, and what might be some of the long-term negative effects of actually going through with that treatment?
That's a great question. And first of all, can you explain what ECT is?
Okay. Can I get to the go to the first part of her
go ahead.
point? Anne-Marie, thank you so much for talking about the raising the issue of honesty, because that is so important, and especially when you have the quote dual demons like you were mentioning of addiction and depression. People are less inclined to talk about their addiction, and so I mean, addiction causes depression, or if you have depression, it makes it so much worse. And the doctor is only working with half of the palette, half of the picture, when the person is not talking about the addiction itself. And so then the treatment and the suggestions are just blown out the water. Like you need to have that other piece of information. So that is so important. And then to get to your other question about ECT, this is a pretty controversial treatment because of exactly the reason that you've mentioned, Anne-Marie. It's because of the memory loss.
What does it stand for?
Oh, I'm sorry, electroconvulsive therapy.
Gotcha.
Sorry. And what that is basically getting an electrical-induced seizure. It's very, very particular and precise to treat depression. And we don't know why it works, but it's been shown to have some effect to improve mood. And so it's usually now used as what we call refractory depression. You go to the doctor, you're treated with medication, it doesn't work, you're on another med, and then finally you've run out of your options, and then it's considered like second line. Okay, let's go to ECT because that might work. It's usually not now suggested as first-line therapy. It has been in the past in the 70s, but there was such an uproar in the public, from the public, that they relegated it to second line. But places like CAMH, where they can do it in a fairly sophisticated manner, will use it. And usually, it's like I said, it's for second-line therapy and for the types of depression where they're concerned about suicidality. And their thinking is, yes, there are side effects. Memory loss is one of the main ones. You know, hopefully, to help you, Anne-Marie, the memory apparently comes back over time, but you get short-term memory loss, and it's very annoying, but then gets better. And I don't know if it's 100% better, but enough. And usually it's a judgment call, just like the other one example with your doctor and you. It's a judgment call, and here's where the kind of art of medicine is this person somebody where I'm worried enough that I'm willing to take the side effect of memory loss versus another person where we haven't tried something, let's try something else first. You see? Yeah.
Yeah. All right, Anna Maria, good insight there. Anna Maria, did that answer your question with Dr. Tarman?
I just wanted to say that I think it's really important that if a doctor, like for me, my doctor didn't warn me of the side effects of going for this treatment. And I think it's really important that a doctor, like if a doctor is going to resort to that ECT treatment for one of his patients, to let the patient know, like, these are some of the side effects that we have experienced with other patients. Because, yeah, like Dr. Tarman said, it's very frustrating, you know, and had I have known that it was going to leave me without, like, certain memories that I'd like to have back, I would have, like, definitely, like, reconsidered the treatment.
I totally agree with you, Anne-Marie.
Yeah. Anna Maria, I really have to thank you very much for picking up the phone tonight and explaining a little bit about your experience, and I know you've probably helped many others. Let's go now to line 2. James is calling in from Toronto tonight. Hi there, James.
Hi, good evening. How are you?
Good evening. We're doing well. Have you got a question or a comment for Dr. Tarman?
Yes. Hello, Dr. Tarman. It's James, and I said I might call when I saw you recently, and I know Dr. Tarman pretty well, and I enjoy a lot of talks with her, and I love her insights. So anyway, I wanted to just briefly talk about my history with depression and addiction, and I just wanted to say that I don't know which came first, the addiction or the depression. I think really the depression came first. And then I found a solution, or at least what I thought was a solution, in alcohol. And needless to say, my depression got worse, and I went on to antidepressants through my family doctor, who I've known since I was a small child. And they didn't really work very well because, of course, alcohol and antidepressants don't really mix too well. So Anyway, once I got clean and sober some 10 years ago, I've been clean and sober for just over 10 years. The antidepressants started working. I got a therapist that really works for me, and I work the program to the best of my ability 24 hours a day. So, I just want to say that I've heard some of the other callers, and I just want to stress that it's not always so bad. It does get better. It does change, and we do this program. And if you have a program, or if you don't have a program, try to get some sort of program. Talk to people, get help, and just 24 hours a day. That's all we have, and that's all we can really hope for. And I'm extremely grateful and extremely happy. So that's all I really want to say.
James, I can't thank you enough for calling in and sharing your insight. Did you want to talk to James?
Yeah, James, thank you so much for giving your story. I mean, you've kind of illustrated a nice trajectory, or an understandable one. You know, you think you first had depression, and then you self-medicated with alcohol. Very, very common. This is probably one of the most common reasons why people pick up drinking in the first place. Then, of course, your depression got worse, which is what you said, and that's exactly what happens. And then you stopped drinking, and your depression got better enough that you could respond to the antidepressants. So it's good. And now I hear that you're seeing a therapist, and you've been in a program, which is the way that it should work. You know, if you're on medication, you want to get into a program of some sort with a therapist or a 12-step program, whatever, so that you can build a foundation so that you can let go of the meds. So, I mean, you've given a really nice archway from, you know, the dark side to the better side. And thank you so much for calling and giving that story.
We're going to take another break here on Living Clean, Living Well. When we come back, more of your calls, your questions, and your comments. Also, at the top of the show, I mentioned about the DSM-5 that is coming out. This is something that you need to know about and how it could affect you in your medical treatment. So a short break, and we will be right back.
Hi, I'm Rogan Christopher of the hit television series Nikita. 1 in 10 Canadians will struggle with addiction in their lifetime, and at least 4 others will be affected by that addiction, be they spouses, coworkers, friends, family, or children. That's why Renison offers compassionate and effective treatment for individuals, families, and children that are affected by the disease. If you or someone you love is affected by drinking or drug use, please call Renison. Let them walk you to the water.
I've had numerous opportunities to get into addiction counseling over the past 5 or 6 years. This one at New Awakenings really appealed to me. First off, the facility here, we've got a swimming pool, there's a gym downstairs. Other side of the fence, golf course, it's fantastic, and the food is, world class. The staff cover all aspects of recovery. These are people with extensive experience in the field, all with the sincere desire to be helpful. If you want a shot at recovery from drug and alcohol addiction, New Awakenings is your best bet. Give us a call. We'll get right back to you.
Welcome back, everybody. Tonight, Dr. Vera Tarman is our guest here on Living Clean, Living Well, and we're talking about depression and addiction. We're going to get right back to your phone calls. Just a little bit of business here. I just want to remind you folks that Recovery Wire magazine is available. Their latest issue is out right now, and you can get your free copy. So Recovery Wire magazine, this is their latest issue right here. You can see it right on screen. And if you go to their website, which we're going to put up for you as well, then you will be able to get your free copy. copy. So Recovery Wire magazine, and you write for them too, don't you?
That's right. It's a good magazine.
Yeah, there are lots of there's a lot of
content.
different things in there to help you. It's hip, it's trendy, it's edgy. It's quite the magazine.
You know, it's recovery is cool.
Yeah. Absolutely. Yeah, exactly. So I also want to talk, we're mentioning off the top of the show about the DSM-5. What is it and why do you need to know about this? So Dr. Tarman, take it away. Why do we need to know about the DSM-5?
Okay, well the DSM, first of all, it stands for the Diagnostic and Statistical Manual, and it's the 5th edition coming out, and it's the book that psychiatrists use to diagnose you. It lists all the criteria that we designate for what is defined as depression or anxiety or bipolar disorder, and on and on and on. So it's really, really important. Now, there's a new edition because it always reflects the changes that have happened in society, so that what was once diagnosed as an illness like homosexuality in the 60s got dropped in the 70s or 80s because it was recognized by then. We became sort of liberal-minded enough to see that that wasn't a medical diagnosis per se. So it's sort of the latest of the social trends and the cultural trends and what we know about science.
But you said this new DSM-5 is quite controversial.
Yeah, it's very controversial because for 2 reasons. One, it's been heavily dominated by the pharmaceutical industry, and that's been shown by most of the people who are on the panel, both to design the actual criteria and also the ones who have judged, yes, this should be in and this shouldn't be in, have been funded by the pharmaceuticals. And we're really worried about that because it means that diagnoses may be invented just so that a drug can be made for them. And this is not just conspiracy theorists. This is like the American Psychological Association didn't want to put their name to it. Like large bodies of service providers have said, hold on, because we now have, I'm sorry, I don't remember the number of diagnoses, but it's going to be tripled. The book will be from this big to this big because there'll be so many more diagnoses. So that the major criticism has been that any normal dysfunction, like I'm just not happy because, you know, I lost my mother, will now be considered pathological and needing treatment.
Wow.
Yeah, so that's the scary edge to it.
Okay, gotcha. Well, as I also mentioned off the top of the show, Dr. Tarman is going to now be a regular contributor with us here on Living Clean, Living Well. She has been working with us for the last couple of years. So we are going to be watching the arrival of the DSM-5.
Yeah.
We're going to be talking about it at length, and also how it affects you, and possibly and how it's going to affect, I guess, the medical industry as a whole. So anyway, that's to come in the weeks to come. Thanks very much for giving us a quick little intro on what to expect. Let's go back to our phone lines. Thanks so much for your patience, everyone. Let's go to line 3, and Dave's calling in from Bancroft tonight. Hi there, Dave. You're live on the show. Go ahead.
Hi, yes. I'm just trying to find out a little bit of information about the depression that comes with years of taking Oxycontin.
Question. Boy, Oxycontin over to oxycodone, very, very topical. Dr. Tarman?
Well, Oxycontin is, for those of you who don't know, it's an opiate medication, and it is essentially a depressant, like alcohol is a depressant. And boy, if you're doing both of them together, that's a pill for depression right there. But, I mean, Oxycontin, what it does is it gives you a euphoric effect at first. I mean, it's a pain reliever. We use it legitimately for pain medication. But if you're using it to get high or to feel better, first of all, over time, because it's a depressant, it's going to enhance any depressive tendencies that you may already have. But then the other thing that happens is when you come down from the Oxycontin, the withdrawal, you have terrible, terrible, terrible depression.
Really?
And it's usually the thing that makes you pick up again, because it's so hard to survive that depression that you have to use just because you can't stand it.
How long can you expect it to last? Does it go hand in hand with how long you were on Oxy?
Yes, it does, but it's not just, you see, that's the thing. It's the same with alcohol, too. When you get off of Oxycontin, you have the initial physical withdrawal, just like with alcohol. But the actual steadying of the neurochemical mess, chaotic mess in your brain, takes a little bit longer than a few weeks. It can last actually a few months. With alcohol, it's 3 months. Oxycontin, I don't know. I would guess probably around the same ballpark figure. So that's why, you know, our previous caller said the client, the patient, has to be honest with their doctor, because you know, it's a depression-inducing pill. Yeah.
Would they give another pill to deal with the depression?
Yes, they usually do. If a person comes in, this is why addicted patients are so heavily medicated. But the thing is the medication that we have, antidepressants, can't cut that kind of depression that a person is dealing with. It might help a little bit, but it doesn't. It's like a little tiny bit versus this huge cloud. It's helpful to some degree.
Sure. Dave, thanks so much for calling in tonight. Last week I asked this next caller to please give us a call this week, and here he is. Let's go to line 1, and Dave's calling in from Midland. Hi there, Dave.
How are you?
Hey, hon. Been thinking about you this week. How's everything going?
Oh, everything's going. Wendy seems to be in a better place right now. She's in hospital.
And for our viewers, Dave, tell them your relation to Wendy.
Wendy is my wife, and a week ago yesterday she took some pills and she had to have her stomach pumped, and she was put in hospital.
Yeah. So she's in she's in the hospital now, and you said she's doing a bit better?
Yeah. Yeah.
Good. Good. And how are you doing, Dave?
You know, I think I'm doing pretty well, considering. I mean, we're talking about depression. I feel I'm probably depressed somewhat, but I'm handling it, and I'm keeping busy. And you know, since Wendy went into hospital, she was registered to be at this ASSIST training, which is Applied Suicide Intervention Skills Training, and I went in her place. That was on Monday and Tuesday, and then on Thursday I went to another training session on suicide care. So I got a lot of information, and I was also reassured that, you know, I'm doing the right thing. I don't have anything to feel guilty about.
No, absolutely not.
Mm-hmm.
David, it's so good that you're back with us again. I've missed talking to you. You know, he brought up a good point. When you're dealing with really tough things in life, and let's face it, life is tough. There's a lot of bad things that we're forced as human beings to go through. How do you know that when you're down and low, that what you're dealing with is just the effects of what has gone on in your life compared to an actual clinical depression? How do you sort that out?
Well, you know, boy, that's such a good question, and to tell you the truth, there is no real answer to that. I mean,
I didn't think there would be.
No, there isn't. And what Dave's talking about, I mean, boy, living with somebody who's trying to kill themselves or suicide, it's very, very difficult. And, you know, guilt and dismay are like the key. I can really empathize with you. So what we would call that is something called reactive depression. It's reacting to the situation, and it's totally appropriate to be feeling, you know, confused and depressed and all those things. I guess where we kind of draw the line medically is when there isn't really a number of when you're supposed to sort of spring back to you know, resilience. It's a term called resilience, but. Like, is it 2 weeks, is it 3 weeks, is it 4 weeks from something like this? But generally, there's a general sense of, again, it's the doctor's gut reaction. Is this going on a little bit longer than it should be? Like, you know, the person's really, really in this, and it's 6 months ago, and they're still in it in the same way, then it's suggesting that something else is going on. But that's part of the problem with the DSM-5 is people are saying that that's going to get crammed right down, so that somebody like Dave is going to be diagnosed right away with depression, clinical depression, when in fact it's probably reactive depression. But there is no clear answer. And this is why I'm so glad that you can't just buy medication you know, at the corner store like apparently you can in some countries, because people would be, you need to have that finesse of knowing, because these are not easy questions. They really aren't. There's no blood lab work result that will say you're depressed. Apparently we're getting better with PET scans, but we can't just order one of those. It's just not available yet.
Right.
Yeah.
Well, you know, Dave, thank you so much for calling in. And Dave's being proactive, too. You know, he was going to those courses.
That's excellent. Excellent.
So that's great. And please stay in touch with us, Dave. You're a good friend to our show. We hope that we're a good friend to you. So we're going to take another break here on Living Clean, Living Well. When we come back, more of your questions and comments. We're talking to Dr. Vera Tarman tonight. She's the medical director of Renaissance, and we are talking about the dual demons of depression and addiction. More of your calls when we come back right after this.
When you find you're slowly going under, and the light only makes it harder, the light only makes it harder to see. I will be your shelter from the thunder, just as long as you give this promise to me. And let me walk you to the water. If you just let go, you will come to know what I mean when I say that it's okay to be this bold. I could ease the hurt if you only turn at my word and you do me this honor. Let me walk you to the water.
Statistics state that it is likely you know a victim of abuse. It could be a friend, a relative, a colleague. It could even be you. 1 in 3 girls and 1 in 5 boys will be sexually abused before they reach the age of 18. Please give them hope. Help us make it stop. Go to abusehurts.com and give to the Canadian Centre for Abuse Awareness.
Depression and addiction is the topic tonight here on Living Clean, Living Well. Dr. Tarman is here to take your phone calls and your questions and also your comments. Let's go back to our lines right now. Let's go to line 4, and Anne's calling in from Hamilton tonight. Hi there, Anne. Thanks for your patience. I'm so glad we got to you.
Thank you, and good evening to you. I'm dealing with my son. He's 31. He's very depressed, and he does have addictions with alcohol and drug use. We've been trying so hard to get him into a rehab. He's anxious. He wants to, but apparently there's a long waiting list. I was wondering if Dr. Tarman can, maybe suggest to me how I can get him into one sooner. I am worried that, he is talking suicide. And like I said, he's very depressed, and I just don't know what to do.
Go ahead, Dr. Tarman.
Well, if he's talking suicide, then the hospital is the most appropriate place to go, because he's not going to, that's too high risk of a situation for a rehab. So that would be my first thought. But the other thing is if he's still using drugs, one way that sometimes people can get in is if they go to detox first. You're from Hamilton? Hamilton. I don't know what the Hamilton situation's like.
We've got Turning Point Detox,
yes,
which is a longtime friend and sponsor of our show.
Yes,
they're terrific,
right.
Anne. Turning Point Detox is their name. I'm going to see whether or not we can get that. There it is. There's their information. If you go onto their website, they're a terrific bunch. Perhaps maybe you'd like to talk to Tammy Francourt, give her a call tomorrow. And she is just great to talk to about the detox process and also maybe what they might be able to do for your son. And you can carry on with that.
So then if he goes into detox, two things can happen. First of all, he'll get clean from the drugs and alcohol, which are causing further depression and possibly to the point of his suicide thoughts. And then once he's in there, the second thing is sometimes you can get kind of a back door through into a rehab more quickly, particularly if you can stay at the detox until the rehab door opens. I know that at Renaissance, sometimes we have people go to one of the hospital detoxes like St. Mike's and actually stay there until they can get a bed sooner, and sometimes get in a little more quickly. There's also places, I don't know about Hamilton, but in Toronto, houses that are sort of dry houses where people sometimes go to before they can get into a treatment center. So they're not actually in the treatment center yet, but they're getting treatment. And they're not living at home in a situation where the parents or the family doesn't really know what to do and they're still using, and the situation is just getting worse. They're at least in a safe environment and I guess it's a bit like, no, it's not really dead time. I'm thinking about jail and dead time, but it's like some kind of time that's safe until they actually get treatment.
If Anne takes her son to the hospital, could he get treatment sooner?
No, he won't get treatment sooner, but he might at least get, well, if he's actually thinking about suicidal thoughts, then he probably needs medication, and they'll at least get him so that he can stay alive long enough for the treatment situation to actually, appear. But I think that a detox is probably a good idea to start with. Yep.
And does that help? Do you have any more questions for Dr. Tarman?
Yeah, the thing is I talked to the detox people. It's called the Men's Withdrawal Clinic on Main Street here in Hamilton, and they keep him for 7 days, and then they send him to a program where they do day programs, and until he's an opening comes up, like from wherever, like Homewood. There's 6 months waiting list for Homewood, and I'm scared. I'm I don't know if he can wait that long, and he doesn't live at home. I have him home. He's been home for 2 weeks, just because I've been keeping him calm and stuff like that. And he got a leave of absence from work. We got a hold of HR from work. They don't have any way of getting him into rehab, and it's just one big circle.
Yep, and that's a tough one. You're being so proactive. A final thought for Anne?
Well, I was just going to say, I know that Renaissance isn't that long. I know Bellwood and Homewood tends to be a bit longer of a wait list than Renaissance, so we might want to consider that one. And also, as I was saying, I know that sometimes there's been this relationship where sometimes people are in a detox for 3 weeks, 4 weeks until Renaissance can let them in. So your situation, I believe what you're saying, but there are other, you can pursue it a little bit further and check out some other detoxes and also rehabs.
Yeah. So right now, Anne, we've got the number for Renaissance on the screen. You can give them a call, and also try Turning Point Detox as well, and see what sort of insight they can offer you. And all the best to you and your son. Let's go now to line 2. Karen's calling in from Orangeville. Hi there, Karen. You're on our show tonight. Go ahead.
Hi, how are you?
Doing good.
Okay, my diagnosis is, first off, I have general anxiety disorder, depression, 2 forms of PTSD, PANS, OCDs, borderline personality disorder, and bipolar. This is what I've been diagnosed with so far. Now, November 11th was 5 years clean from crack, and what happened January 4 years ago is I had my son, which was a really bad C-section. Now, I've been on narcotics, everything from hydromorph to fentanyl patches to now Percocets, and they can't fix the problem. I go for Marcaine injections here and there, which obviously don't last more than 4 hours. So now I've been on narcotics, which I pick up every other day versus 1 month at a time, and because that way I won't abuse them. But my fear is, the pills are really good to take. I mean, they're fun. They make you feel better. Being a previous addict, obviously, I know I'm addicted to them to the point where I'm enjoying them again. So I'm kind of stuck between a rock and a hard place of what to do.
Go ahead, Dr. Tarman.
Well, you're really describing exactly that. This is a rock and a hard place for the person with an addiction history and who's also experiencing chronic pain. A person, especially with an opiate addiction, people become actually hypersensitive to pain, so you're going to feel pain even more than a normal person who's not been on opiates before. So you're kind of in a double rock and a hard place. But you're kind of doing the best thing you can, which is that you're picking up every 2 days rather than being able to binge on a whole month's supply. But I don't know, it's a hard one. I'd like to say if you could get off of them, that would probably help your depression and also your pain. But getting to that point, getting in withdrawal hurts too. You're going to feel your pain even more. So, yeah, you are in a rock and a hard place. All I can say is, yes, I really feel badly for you. But what to do next is something that you're going to have to try different steps with your doctor. Mm-hmm. Yeah. But you're definitely in a difficult situation. And again, you're not alone. This is very common. Yeah.
Wow, Karen, thank you so much for calling in tonight.
There are other medications, but I bet you Karen's already tried those.
Yeah.
Like we have other types of meds that are not narcotics to try. Mm-hmm.
And as always, we're not able to give medical advice. She must deal with
That's right.
with her doctor.
Yes, yes.
Yeah. Thanks for calling in tonight, Karen. Let's go to line 1. Scott is calling from Toronto. Hi there, Scott.
How are you tonight?
We're doing okay. How are you?
Okay, thank you. I am suffering from chronic depression, anxiety disorder, and I'm also an alcoholic in a 12-step program. I am stuck on step number 1 and having a hard time getting to step 2 and 3 because of the religious part of it. But that aside, I always feel that suicide is a comforting feeling that it's an out, that if I ever decide to just, like, check out, I can check out. But I know that's not the right thing to do, and I have been hospitalized twice in the past year for this feelings that I've had. I'm just wondering, I have just come into some money, and would it be worth my while to go to a 28-day program? Because I've heard so many conflicting reports, people saying, if you've drank for 20 years, 28 days isn't going to help you. Is it something that I should be looking at? Is it something that would help me? I'm very, very confused on what to do.
Scott, hang on a sec. We're going to let Dr. Tarman weigh in on this.
Yes, Scott, I just wanted to know, are you still drinking now?
But it seems like I don't drink for 4 days, then I'll drink for a day, then I won't drink for 4 days, and I'll drink for a day. And my doctor said it's what we call harm reduction drinking. And so it's not as abusive as it used to be, whereas it was every night. So I guess I'm a bit better as far as the drinking goes. And I do know what I have to do, but it just seems like little triggers set me off, and I have to drink just to keep sort of sane, if you will, if that makes any sense.
Absolutely. Okay, Scott, we're going to let Dr. Tarman in here.
Yeah, so I think that here's how treatment might be helpful for you. It'll give you more than the 4 days, because you're right, harm reduction, that's what you're doing, and it's probably drinking once every few days is better than every day, for sure. But one of the things it won't do is help with your depression and your motivation to get clean. You won't really get that until you've had at least 3 weeks of clean time under your belt, which is what a rehab will do. 21 day or 28 day, it'll give you clean time if nothing else. You'll feel better, and that will motivate you more. That's the first thing. And then the other thing is that you said that you're stuck on step 1. Well, it's going to help you through education, through hearing other people's stories, through the doctor that you'll be speaking with, to get step 1. You have a problem with alcohol, and if you deal with that problem, like once you get that piece, and you're not going to get that on your own because your addict mind doesn't want to hear that. But once you get that piece, then you're going to be able to move on to step 2, which is, I mean, you're calling it religious. I mean, that's the other thing that'll happen is you'll get the difference between what we call a higher power versus religion, so that it'll help you deal with that obstacle, which, by the way, is so common. People have that question all the time.
Yeah,
when
we've
they're
had
new
phone
to
calls
this.
into the show on it.
Yeah. So it's going to open up a door. Let's see it this way: your 28-day program will open up a major door so that you'll be willing to get to the next step. So just from what you've told me, I'd say it's pretty worthwhile of a thought. Yeah.
Could he benefit with a detox?
Yeah, a detox for sure to get a few days behind him. But yes, for sure he could, and it'll also like prepare him for the actual treatment itself. Yeah.
If he were to choose Renaissance, you know that program well. What could Scott expect?
Well, Renaissance is first of all primarily a 12-step program, so it'll really open up his sort of awareness about 12-step programs, which it's obviously he's been going to meetings, so he's already aware of that. 12-step, pardon me, Renaissance is also gender specific, so he'll be with a group of guys. He can talk about whatever. You don't have to worry about the women there. That people really like that. So he'll get a sense of fellowship of people who are feeling just how he is. The other thing about Renaissance that's different and special is that all of the workers themselves are in recovery themselves. So even the workers are going to be able to connect. And any question he has, they've already thought of themselves. You know.
We had two of the counselors from Renaissance on a couple of weeks ago, and I really loved the fact that you're right, that they're in recovery themselves, and the way that they were able to relate and talk to people. It was just invaluable.
Yeah, yeah. There's a real difference, and people say that they say that they feel a difference when somebody that they've been working with has been through the same thing, versus you know, just a clinician who's read about it. Yeah.
So Scott, I hope that helps you out there. Perhaps maybe, as Dr. Tarman was saying, you could benefit from a detox. That would help. And then as well, if you wanted, you could check out the program at Renaissance or any of the other wonderful treatment centers that we've got. We're going to take our final break here on Living Clean, Living Well. When we come back, some final thoughts from Dr. Tarman.
I've had numerous opportunities to get into addiction counseling over the past 5 or 6 years. This one at New Awakenings really appealed to me. First off, the facility here. We've got a swimming pool, there's a gym downstairs. Other side of the fence, golf course. It's fantastic, and the food is, world class. The staff cover all aspects of recovery. These are people with extensive experience in the field, all with the sincere desire to be helpful. If you want a shot at recovery from drug and alcohol addiction, New Awakenings is your best bet. Give us a call. We'll get right back to you.
Welcome back, everyone. First of all, before we get to final thoughts, I'd like to thank everyone that called in tonight, whether you were there to say, you know, this is what happened to me, this is what I did, to even asking for help and some advice from Dr. Tarman. It was great you had the courage to pick up the phone and talk tonight. So we've been talking about depression and addiction. Some final thoughts, Dr. Tarman?
Yeah, I'd like to say a couple things. One, I'm really glad to be here and answering your questions. I love it when people call in. In terms of the dual demons of depression and addiction, I think that the major thought that I want to give as a final thought is to be honest with your physician about your drug use or alcohol use, because depression is such a big area. There's so many really useful treatments, but we won't really know what to suggest unless we know exactly what we're dealing with. But there is treatment, and it's possible, but you know, that will help.
Yeah. Well, thank you very much for joining us. And as I mentioned, Dr. Tarman is now going to be a regular contributor on our show. You will see her every other week. So it's going to be great to have a medical doctor working with us here. I will see you next week. So long, everyone.
Living Clean, Living Well has been brought to you by Renaissance. The road to recovery starts here. Living Clean, Living Well has